Over 60? These 5 Alzheimer tests might be riskier than you think. Are you worried about your memory or that of a loved one? In today's video, I'm going to reveal something that might surprise you about Alzheimer's testing, information that could significantly impact your healthcare decisions. By the end of our time together, you'll understand which common tests might actually be putting you at unnecessary risk, what alternatives exist, and most importantly, how to advocate for yourself in the doctor's office. This isn't about avoiding diagnosis. It's about getting the right kind of care without potential harm. Stay with me, because what I'm about to share could change how you approach brain health entirely. Let's dive into a topic that concerns many of us as we age: Alzheimer's. Disease testing. I know many of you watching have either considered getting tested or have a loved one who might need assessment. But what if I told you that some of the most commonly recommended tests might be doing more harm than good? That's right. Not all. Alzheimer's tests are created equal, and today I'm pulling back the curtain on 5 tests that deserve your careful consideration. Have you ever wondered what actually happens during an Alzheimer's evaluation? Most people think it's just about memory questions, but there's so much more to it. The testing landscape has changed dramatically in recent years, and keeping up with these changes could make all the difference in your care journey. How many of you have actually researched the tests your doctor might recommend? If you're like most people, you trust your healthcare provider completely. And while that trust is important, being an informed patient is equally crucial. The first test we need to discuss is spinal fluid analysis. This procedure involves collecting cerebrospinal fluid through a lumbar puncture. Yes, that means a needle in your spine. While this test can detect certain proteins associated with Alzheimer's, have you considered the potential side effects? Some patients experience severe headaches lasting for days, and there's always a small risk of infection or bleeding. For someone in their 60s or 70s, these risks might outweigh the benefits, especially when other, less invasive options exist. Have you or someone you know undergone this procedure? Was the recovery process explained thoroughly beforehand? Moving on to our second test, brain PET scans using radioactive tracers. These specialized imaging tests can visualize amyloid plaques in the brain, which are associated with Alzheimer's disease. But here's what many doctors don't emphasize enough. These tests expose you to radiation. While a single scan probably won't cause harm, is it necessary to take this risk when the results might not actually change your treatment plan? The American Academy of Neurology has questioned the routine use of these scans, noting that positive results don't always correlate with symptoms. Have you been told about these limitations by your healthcare provider? The third test that raises concerns is genetic testing for the APOE gene, particularly the E4 variant that's associated with increased Alzheimer's risk. Now, I want to ask you something important. Would knowing you carry this gene actually benefit you, or might it create unnecessary anxiety? Unlike some genetic conditions, carrying the APOE E4 gene doesn't guarantee you'll develop Alzheimer's. Many people with this gene variant never develop the disease, while others without it do. Plus, this knowledge could potentially affect your insurance coverage or create psychological distress. Has anyone discussed these implications with you before suggesting genetic testing? Fourth on our list is extensive neuropsychological testing. These battery of tests can take hours to complete and can be mentally exhausting, especially for someone already experiencing cognitive difficulties. While they provide detailed information about cognitive function, have you considered whether a briefer cognitive assessment might be sufficient? For many older adults, particularly those with physical discomfort or anxiety, sitting through hours of challenging tests can be distressing and may not yield significantly better information than shorter assessments. How would you feel after being mentally challenged for 4 straight hours? Is that experience worth the potential distress? The fifth test we need to discuss is experimental blood tests that claim to predict Alzheimer's years before symptoms appear. While blood tests are certainly less invasive than lumbar punctures, these particular tests are still in the research phase. Some companies are marketing them directly to consumers, but their accuracy and predictive value aren't fully established. Would you want to know you might develop Alzheimer's a decade from now if there's currently no way to prevent it? How would that knowledge affect your quality of life and mental health? These are crucial questions that aren't always addressed in the marketing materials. So what alternatives exist? Are there safer, more appropriate ways to assess cognitive health? Absolutely. Brief cognitive assessments like the mini-mental state examination or the Montreal Cognitive Assessment can provide valuable information without unnecessary risks or stress. These simple paper and pencil tests, administered by a healthcare professional, can detect cognitive changes that warrant further investigation. Have you heard of these options? Has your doctor discussed them with you? Another approach gaining traction is functional assessment, evaluating how well you perform everyday activities rather than just testing your memory for random words or numbers. This might involve discussing how you manage your medications, finances, or household tasks. Isn't this a more relevant measure of how your brain is functioning in real life? Would you prefer this kind of assessment over abstract memory tests? Let's talk about something that's often overlooked: the role of reversible conditions in memory problems. Did you know that vitamin B12 deficiency, thyroid disorders, depression, certain medications, and even sleep apnea can cause symptoms that mimic Alzheimer's? Before undergoing invasive tests for Alzheimer's, shouldn't these conditions be ruled out? How many of you have had a comprehensive blood panel to check for these issues? This simple step could potentially identify a treatable cause of your cognitive concerns. Brain health monitoring over time is another approach worth considering. Regular check-ins with your doctor to track any changes in your cognitive function can be more valuable than a one-time extensive evaluation. This longitudinal approach allows for the detection of patterns and can help distinguish between normal aging and something more serious. Wouldn't you prefer this kind of ongoing relationship with your healthcare provider rather than a single high-stakes assessment? Now, I want to address something important: the emotional impact of Alzheimer's testing. Have you thought about how you might feel after receiving results? For many people, especially those without symptoms who are testing based on family history, concerns, the anxiety and stress following a positive result can be overwhelming. Is this psychological burden worth it if the test doesn't lead to a specific treatment plan? Mental well-being is a crucial component of brain health, and testing decisions should take this into account. Let's consider the financial aspect as well. Some of these advanced tests can cost thousands of dollars and might not be fully covered by insurance. Is it worth spending your retirement savings on tests that might not change your treatment options? Have you researched what your insurance will cover before agreeing to expensive testing? Being financially savvy about healthcare decisions is particularly important as we age. There's also the matter of test interpretation. Even the most accurate tests can sometimes yield false positives or false negatives, and different doctors might interpret the same results differently. Have you considered getting a second opinion before making decisions based on test results? This step is often overlooked, but can provide valuable perspective, especially for something as significant as an Alzheimer's diagnosis. I want to emphasize that I'm not suggesting you avoid all testing. Early detection of cognitive issues is important and can lead to better outcomes. But the key is appropriate testing at the right time for the right reasons. Have you had a candid conversation with your doctor about your specific risk factors and what testing approach makes the most sense for your situation? This personalized approach is far more valuable than following a one-size-fits-all testing protocol. For those of you who have family members with Alzheimer's, I understand the fear that can drive the desire for extensive testing. Living with that uncertainty can be challenging. But ask yourself, would knowing for certain actually change how you're living your life right now? Many people find that focusing on brain-healthy habits is more empowering than fixating on test results. How might your approach to daily life change if you shifted your focus from testing to prevention? Speaking of prevention, let's talk about what actually works. Regular physical exercise, particularly aerobic activities like walking, swimming, or dancing, has been consistently shown to support brain health. Social engagement, mentally stimulating activities, a Mediterranean-style diet, quality sleep, and stress management all play crucial roles too. Have you incorporated these elements into your daily routine? Aren't these positive lifestyle changes worth adopting regardless of your test results? Another consideration is timing. When is the right age to consider Alzheimer's testing? Some researchers suggest that very early testing, decades before symptoms might appear, could eventually lead to preventive treatments. But as of now, testing, without symptoms, primarily serves research purposes rather than individual benefit. Are you willing to participate in research that might help future generations, even if it doesn't directly help you? This is a personal decision worth reflecting on. The landscape of Alzheimer's research is evolving rapidly, with new tests and treatments constantly under development. What seems cutting edge today might be outdated tomorrow. This is why staying informed and maintaining open communication with healthcare providers is so important. How do you stay updated on advances in brain health research? Are there reliable sources you turn to for information? Let's discuss the concept of shared decision-making. Gone are the days when doctors simply told patients what to do. Modern healthcare emphasizes partnership. You and your doctor working together to make decisions that align with your values and preferences. Have you experienced this kind of relationship with your healthcare provider? If not, what steps might you take to establish it? For many of you watching, concerns about cognitive health might not be about yourselves but about loved ones. Approaching a family member about cognitive testing requires sensitivity and respect. Have you struggled with these conversations? Would it help to involve their trusted healthcare provider rather than suggesting testing yourself? Sometimes a third party can facilitate these difficult discussions more effectively. I want to address a difficult truth. No test can predict with absolute certainty who will develop Alzheimer's disease. Even the most advanced biomarker tests have limitations. This uncertainty can be frustrating, but it's important to acknowledge. How do you cope with health uncertainties in general? Developing healthy coping mechanisms can serve you well not just in this context, but in all aspects of aging. Now, let's talk about clinical trials. If you're considering Alzheimer's testing, you might also be interested in participating in research. Clinical trials offer access to cutting-edge treatments and contribute to scientific advancement. Have you explored what trials might be available in your area? Organizations like the Alzheimer's Association maintain databases of ongoing studies that are seeking participants. As we approach the end of our discussion, I want to emphasize the importance of holistic brain health rather than focusing narrowly on Alzheimer's testing. Cognitive well-being encompasses emotional health, physical health, social connections, intellectual stimulation, and purpose. Isn't this broader perspective more empowering than reducing brain health to a single test result? How might this shift in thinking affect your approach to aging? I hope this information has given you a new perspective on Alzheimer's testing and empowered you to make more informed decisions. Remember, being cautious about testing doesn't mean ignoring brain health. Quite the opposite. It means approaching your cognitive wellness thoughtfully, with a focus on what truly matters and what genuinely helps. If you've stayed with me until this point, I'd love to hear your thoughts. What testing approaches have you or your loved ones experienced? Did your healthcare provider discuss the risks and limitations with you? Please share your experiences in the comments below. Your insight might help someone else navigating this complex territory. And if you found this information valuable, please hit that like button to help others find this video. Subscribe to our channel for more content on brain health and aging well. The journey to understanding and protecting our cognitive health is ongoing, and I'm committed to providing you with the most accurate and helpful information possible. Remember to click on the video appearing on your screen now for more insights on maintaining your brain health as you age. Thank you for your attention and trust. Together, we can approach brain health with both hope and wisdom.